Assalamualaikum, I am Dr. Junaid Jahangir Abbasi, and today I am going to tell you how to do a short case with a large head. In examination, the command may be do the general physical examination, but once you come and once you see that the head of the child is large, then you need to focus on the relevant points of the head examination and then do the routine general physical examination. So he is a 3-month-old boy with a large head. First of all, इंट्रोडक्शन कंसेंट एंड ग्रीटिंग। अस्सलाम वालेकुम, मेरा नाम डॉक्टर जुनैद है और मैंने आपके बच्चे का मुआयना करना है। इंशाल्लाह दौरान मुआयना आपके बच्चे को तकलीफ नहीं होगी, ठीक है। फर्स्ट ऑफ ऑल, डू द जनरल ऑब्जर्वेशंस। जस्ट लुक एट द चाइल्ड, ऑब्जर्व वेदर ही इज शॉर्ट और टॉल, large head and tall, maybe psotos, large head and short, maybe achondroplasia. Look for some dysmorphic features. Look for the faces of hemolytic anemia. Look at the skin. Is there any neurocranial stigmata? Is there any bruise present? Large head with a bruise can be due to non-accidental injury. Look whether skeleton is normal. Is there any skeletal abnormalities? Look whether some contractures are present. How is the child overall? Is he responding to the commands? Is he maintaining an eye contact? Is he responsive? Does he seem to be mentally retarded or mentally well? Then after these general observations also include how is the overall tone? The child is maintaining a tone or not? Is there any abnormal movements of the hands or feet? Once you have done with the general observations, come to the head. The head is important. In the head, inspection, palpation, percussion, auscultation. Now, just focusing on the head, if the camera can focus on the head, inspect. Is there the skin overlying is shiny or not? Is there any veins prominent? How is the shape? Whether the skull is bulging anteriorly or posteriorly or parietally. In this case, you can observe, if the camera can focus, the skull is prominent parietally. After the shape, full inspection, come to palpation. When you palpate the skull, palpate the sutures. See whether the sutures are split. In this case, the sutures are split. Then take the head circumference. Ideally, in books it's written that take 3 readings and take the largest. But here I will take only 1 reading because the time is short. Take the head circumference of the parents also. मैं आपका भी सर का साइज लेना चाहता हूँ, क्या बता रहे हैं please? Inform them and take the head circumference of the parents also. Thank you. Once you have done with taking head circumference, put your hand on the anterior frontal array. Feel whether there is pulsation or not. Pulsations may be absent in hydrocephalus. Feel whether the anterior frontal array is bulging or not, it is wide or not. Then once you've done with percussion, palpation, go to percussion. On percussion, feel the crackpot sign. This is also called as McEwen sign. This is crackpot sign. After percussion, auscultate. Auscultate for bruit. The bruit can be found in AV malformation of the vein of Gallant. Once you have done with auscultation, the 4 steps on just head are completed. After inspection, palpation, percussion and auscultation of the head, come to the eyes. In the eyes, look for the sunset sign, look for proptosis. If the camera can focus, there is sunset sign in this child. and there is proptosis of the left eye. Proptosis actually shows raised ICP. Also look for cataract, squint, nystagmus. If larger child, field of vision and visual acuity also. Look for the cranial nerve palsies. Third nerve and sixth nerve palsy can be present in with raised ICP. And offer the examiner that I would like to do fundoscopy, because fundoscopy is important with raised ICP. You can have papilledema and other features also on fundoscopy. Once you have done with the eyes, go to the ears. See, is there some hearing aid present? After ears, come to the chest. If the camera can focus, look at the chest and see whether there are signs of rickets. Then on the abdomen, see, is there scar of VP shunt? Then palpate for liver and spleen. Hepatosplenomegaly with a large head can be found in congenital toxoplasmosis. After abdomen, turn the patient gently. एक साइड पे उसको कर लो. Look at the anal wing. For anal wing, gently you have to scratch the area around the anus, and the anus will show a reflexive contraction. I need water. Gently scratch the side of the anus, and the external anal sphincter will show a reflexive contraction. Then see the spine. Look for any swelling, myelomeningocele, tuft of hair, or any scar on the spine. After spine and anus, come to the lower limbs. Do the motor examination of the lower limbs. I've checked the tone. Now I'm going to see the reflexes. For power, he is a small child, he will not obey the commands. So just see whether he is taking these both legs up or not, is taking them sideways or not. In this case, he is moving and he is taking both the legs up. So generally you can say that the power is fine. Or at least it is 3/5. So after motor examination of the lower limbs, come to the motor examination of the upper limbs and do the motor examination of the upper limbs also. Then do developmental assessment of the patient. He is a 3 months old boy. So I will expect social smile and neck holding in this age. So now let's check these things. Gently hold the head. Obviously there is no neck holding because the weight of the head is so much that the child is not able to hold the neck. So gently place it back. Since he is crying, so I will ask the father whether he is having a smile or not. जब ये चुप होता है, आम दिनों में मुस्कुराता है नहीं. So there is no smile. So the developmental age is less than 3 months. Thank you so much. बहुत बहुत शुक्रिया. And cover the child also.